So these two papers, they are for just our understanding how powerful imaging tool IVUS is in terms of detection of calcium. And if you are doing angioplasty and if you are suspecting that this lesion, there is a calcific lesion, IVUS is an excellent tool, and I will show you why. So angiographically visible, non-visible calcium at IVUS maximum calcium angle greater than 180 degrees. And the summary of this is that lesion with calcific arc of greater than 180 degree measured by IVUS. The main difference between those visible versus non-visible on angiography is calcium thickness. And this is a calcific lesion imaging assessment, thickness and reverberations on IVUS. We now have OCT, which we know has a better resolution than IVUS, and it has certain advantages over IVUS. And I'm going to show you the comparative comparison between OCT and IVUS here. The main advantage of OCT is when you are assessing thick calcium. And in IVUS, what you find with thick calcium is you cannot see anything beyond it. But in OCT, you will be able to see something. In thin calcium, again, regardless of thick or thin calcium, you are not able to see the structures beyond. But here you can see it very nicely. Thin calcium in both these pictures, you can see beyond it. But in this picture, you can see that you can't see a lot. But nowadays, if you put this on dynamic imaging or you do a pullback, what you look for in cases of thin calcium are reverberations. So if you have, so you can see one reverberation here, one reverberation here. And if you have reverberations, this means that this is thin calcium. This is not thick calcium. If you can't see anything at all, then it is more likely to be thick calcium. So this is a way of looking at it, because we look at three things. We look at the arc, we look at the thickness, and we look at the length in deciding and grading the severity of a calcific lesion, about whether it will give to conventional balloon dilatation preparation or whether it needs more calcium modification by either rotablation or IVL and cutting balloons and stuff like that.